right, you've heard all the jokes, right? You're experiencing your own personal summer, you know, a heat wave when it's wintertime. And of course, what we're talking about is menopause. That's one of the many symptoms of menopause. Dr. Paula Duncan, a certified menopause specialist with Cone Health Center for Women's Healthcare at the Med Center in Kernersville, is here to talk all about it. So let's just kind of start with, you know, the thing, because some people say, oh, I'm too young for that, or whatever it is. And you go, okay, well, let's talk about how does someone know if they're in menopause or perimenopause?
So I would say to know first is to know when to kind of expect that or how we define it. And we define it as 1 year of no period. That's tough because symptoms start well before that. And so it's really only an official diagnosis when we make looking back, but you have some clues before. Some of those symptoms can be pretty subtle. It might be something just like changes in your menstrual cycle or changes in your mood.
And you know, as women, we just kind of chalk that up to, it's just being a woman, whatever. But really, knowing the symptoms of menopause and perimenopause is really important. So let's kind of talk about what the average age is
Mhm.
of that.
So the average age of menopause is 52. But symptoms again start well before that. And the symptoms, the timing of those symptoms will also depend on what those symptoms are. So if it's something like menstrual changes or mood, that might be many years before you've actually gone through that 1 year of no period. Whereas if it's something like hot flashes, it might be something closer like the 2 to 3 years before you officially hit that 1 year of no period.
Yeah, and we're also talking joint pain, we're talking sleep
Mm.
problems, we're talking brain fog, we're talking heart palpitations, or even something called frozen shoulder.
Yeah. Yep. Yeah, and you named, I would say, probably some of the most common. There are certainly more. Um, and I had a patient recently bring in a sheet of paper where it had like the 30 most common symptoms of menopause, and she just checked off the vast majority of those. And I think that it's helpful, um, both for the patient and the physician having that information. And other ones that maybe people are a little bit intimidated to talk about too, but that are important will be drop in libido or change in your desire, vaginal dryness, pain with intercourse. Those are all really important and also super common. And so I think helping knowing that helps women to know that it's not shameful to talk about that, and it's not uncomfortable for us as gynecologists.
Right. And I think as women, I think we kind of chalk it up to, I just need to get myself together, right? Like I'm not thinking clearly, or, you know, I'm getting older, my joints are hurt and I need to walk more or whatever. And it really is, it's that loss of estrogen that's playing in with all of that. I think women don't realize, oh, it's like, it's a thing.
Yes, and estrogen, there are receptors for estrogen on just about every tissue or organ in our body. And so it's crucial. Our body has seen it our entire lives. And it's not just that it's a slow drift to that estrogen. It's most women, it's pretty precipitous when you go through menopause. You go from having it to not. And that's really hard on our bodies.
That's right. And so we really need to pay attention, and we don't need to just live with it. We need to go to the doctor, talk about it, and figure out how do we deal with that. Let's talk a little bit about like changes in our diet or exercise with symptom relief.
Yeah, so I would say changes in diet and exercise, the short answer is yes, they always help. And they're super important. And it's not necessarily a direct relationship. So, exercise helps a lot of the symptoms that we have. So, it will affect how well we sleep. It affects our mood. It helps our bones, which is something that often is overlooked when we talk about menopause. So, our bone health is super important. And it also helps our heart. It helps our metabolism. And I see a lot of women when they're going through this phase of their lives that they start noticing weight gain, not just the number on the scale, but even where the weight is distributed. And exercise is important in that regard. And starting around age 40, we notice what we know is women will start to have a decline in muscle mass. And that is the primary determinant for us about our basal metabolic rate or how many calories we burn in a day. And not that weight loss is all calorie in, calorie out. We don't want to lose sight of like overall health. But in terms of like what muscle does, both for our bone health, our heart health, it's an important organ system that starts to decline. And if we're not focusing exercise on strength training, that's important. And then also, if we're not sleeping well, that's going to affect our weight gain and our mood, which again, symptoms of menopause, so those can be exacerbated. And then if we start to gain weight, that affects our mood as well, and it affects our sex drive. So all of these things are related and can be improved with like a healthy diet with clean, unprocessed food if possible, rich in fruits and vegetables, lean meats, complex carbs, all of the things that like we know, but are sometimes easier said than done too.
Sure, and that is part of the puzzle. It's not the only thing that will give you relief from those symptoms and things of that
Oh,
nature. So we're going to talk about that a little bit more because I think a lot of people, especially in that menopause range, all they're seeing on Instagram is eat more protein and exercise more, and that's not fully the whole full picture.
yes, 100%. There is, unfortunately for menopause, no magic bullet for any one of these things. And when I see a patient in the office, I'll say, what are your symptoms? And we make a little graph and I say, what will hormone therapy help and what will it not help? And what will diet and exercise help? What will it not help? And just going through those things and seeing what's most important to the woman.
So a lot of people would want to know, okay, is there like a quick and easy way? Is there like a blood test to check hormone levels for menopause?
So there is a blood test that can tell us if someone is in menopause, but it really only has utility in certain circumstances. So that's women who have had a hysterectomy, so they no longer have their uterus. It would be for women who maybe have PCOS and which is polycystic ovarian syndrome, and they have very irregular cycles at baseline. Or for women who are very young and have stopped getting their menstrual cycles, and we want to make sure that they don't have premature ovarian insufficiency. But for most women, the most reliable way to tell if someone's perimenopausal is based off their age, but also looking at what are their symptoms. And I think that also falls on us as physicians to believe women when they come in and tell us that they're having a problem.
Does the blood test not work because the hormone levels go up and down so much?
Correct. That's absolutely correct. Yep.
Okay. All right. Because like what the blood test that you gave on a Thursday and the blood test that you gave on a Tuesday might be totally different things. And so,
Yes, any given
all right.
time, any given month, or even within a single month, we could check that result and we would get completely conflicting results.
All right. Because yay, women, your hormones go like this, like a roller coaster. All right. So, what are some common misconceptions or maybe outdated information that you'd like to set straight?
Yeah, I think the biggest is just the original interpretation of the Women's Health Initiative study, which is where a lot of like the fear, both from providers and for women, when it comes to prescribing hormone therapy. And it was basically where it started saying like women are increased risk of heart disease from it and increased risk of breast cancer. But really, that took the nuance from the study and wasn't quite accurate, and how it was presented was also misleading. So we went from many women being on hormone therapy to almost nobody being on hormone therapy. And think about it, there's a lot of harm that came from just how that was interpreted. So when I see patients, I talk a lot more about the nuance of what that study showed, what hormones were used in it, how we don't use those hormones anymore. So we use a very different regimen, most practitioners do. um, and we don't think that hormone therapy causes breast cancer. And in fact, in some arms of the study, it actually showed a decreased risk of breast cancer. So bearing that in mind, there's again a lot of nuance to that, which is great to have with your provider. And I had a patient recently put it really well in terms of talking about breast cancer risk. And, she put it in the coolest way possible. She said, so it doesn't really start the fire, but it could add fuel to it. And I think that that's really well said. So if you have hormone receptive breast cancer, it's not that it caused it, but it might feed that breast cancer.
And
And I think
that's
we
why
kind
you
of
need some preventative screenings and things like that to go along with that.
yeah, so getting your mammogram. And we kind of touched on this where hormone therapy is not the magic bullet for all symptoms of menopause, but if we can even make some of them better, that's really what our goal is. So having an honest and frank conversation about what will work and what will not.
Okay, we've got about a minute left. As we wrap things up, what's the most important thing that women should know about menopause?
So I say the most important thing women should know is that it is not a pathological state unless you are under 40. So if you're very young when you go through menopause, that all women with enough time go through it. And so we don't want to over medicalize it, but also we should address it. And if it's affecting your quality of life, I highly recommend seeing your provider. And if your provider is not comfortable, know that there are many who are. It doesn't take a specialist to do this. It just takes a physician or a provider who is willing to take the steps to stay up to date and be educated. And I think being an advocate for your health and not maybe taking that first answer if your doctor says they're not comfortable, persist, because this stuff matters, both for your long-term health and for your quality of life.
Yeah, it's not just the today symptoms, it's the bone loss and all that other things down the line as well. All right. Thank you so much for your time and your expertise. Maybe you want to send this interview to a friend or a family member. This is going to be in the To Your Wellbeing section of our website.